This is the story of Jolie Moore, a 36-year-old woman living in Springfield of Illinois. She was suffering from rheumatoid arthritis. On July 1, 2007, she went boating with her family, but the day after, on July 2nd, everything changed. She was feeling a little bit unwell, but she was well enough to go to work and then to the clinic to get her second shot of clinical trial, with the dream that this treatment would cure her. Afternoon of July 3rd, she was feverish and vomiting. It took only 21 days after that day. Her liver failed, her body became septic because of a fungus infection, and there was a football-sized blood clot in her abdomen. She died that day with her husband of 9 years by her hospital bed, leaving behind a 5-year-old daughter and a big question from her husband. Would my wife still be alive today if she hadn't participated in this study?
Rheumatoid arthritis, abbreviated as RA, is an autoimmune disorder which is caused when the immune system attacks its own tissue, including the joints. RA affects joint linings, causing painful swelling and inflammation. The inflammation associated with the condition can cause bone erosion and joint deformity. In terms for treatment, there is no cure for RA. However, physiotherapy and medication can help slow the disease progression. Rheumatoid arthritis and genetics. The reasons behind developing RA is still unknown. However, researchers have identified some of the genes that control the immune responses. Having these genes increases the risk of developing RA. The history of rheumatoid arthritis. Treatment of rheumatoid arthritis in old times included bloodletting and leaching, which failed to improve the condition of patients. After that, they started using heavy metals in treating various diseases, and one of them was RA. Over years, gold showed success and is still part of drugs used for RA patients nowadays. In addition to that, plant extracts were also used to treat pain of rheumatoid arthritis and other forms of arthritis.
Although gene therapy had been on the agenda for over 25 years, Moore's death still came as a shock to this field. RA gene therapy had been suggested in the 1990s by Bandara and colleagues in a paper where they suggested delivering genes locally to the linings of joints. This strategy promised to provide therapies that are cheaper, safer, and more effective than existing ones. The efficacy and safety of gene therapy for treating arthritis had been demonstrated extensively in preclinical trials of animal models, which involved mice, rats, and rabbits. Other than the trial which involved Moore as a subject, there have only ever been 2 trials conducted prior to this. The first ever trial to be conducted was documented and published in 2005, sponsored by the University of Pittsburgh. Researchers concluded that the trial was safe and successful, demonstrating for the first time ever that genes can actually be transferred to human joints. The target gene used was IL-1RA, and the vector was MFG IRAP. 4 years later, in 2009, another research paper was published which documented a clinical trial sponsored by the University of Dusseldorf in Germany. As with the first study, researchers found the gene therapy to be both effective and successful. The target gene and vector used for this study were identical to those of 2005, using IL-1RA and MFG IRAP respectively. So, you may be wondering, if both trials prior to Moore's death were successful, what could have went wrong? First, the target gene and viral vector used for Moore's trial were different than those used in previous trials, which may have impacted Moore's immune response. Second, the trials prior to Moore's death were conducted ex vivo, which meant affected cells were extracted from the patients, subjected to gene therapy, and then injected back into the patients. Whereas with Moore's trial, patients were injected with therapeutic genes immediately. Third, the patients in previous trials were due to have joint replacement therapy shortly after their trials, so the long-term effects were never measured. Finally, previous trials had only one short phase, whereas Moore's trial had 2 phases and varying doses of treatment. Now, although Moore's death was not attributed to the gene therapy trial, the variance between earlier trials and Moore's are too significant to simply overlook.
In this story, there are several reasons that led to her death. The first major one being that she enrolled in an experimental trial that would help her minor arthritis as suggested by her current doctor that was treating it. There was 2 things very wrong with this. Her doctor was actually financially invested in helping run the trial, which was a conflict of interest. And her arthritis was not life-threatening in being treated with current drugs, so the gene therapy trial was not a last choice scenario. As well, the consent documents signed by Moore were misinformative and confusing. The Washington Post stated that after a very long list about how the trial could potentially help her, it briefly mentions that they do not expect any medical benefits from it. It also makes the side effects very vague and lists death as a very rare circumstance. After being injected in her right knee with the gene therapy, things turned very wrong very quickly. The infection, organ failure, and the blood clot caused her death, and the doctors couldn't determine why.
The aftermath was detrimental. Jolie laid there in the University of Chicago Medical Center, dead, with more health issues than she originally started out with. On that day, Rob Moore, in a state of shock, confusion, and grief, had lost his beloved wife as well as the mother of his 5-year-old daughter, Tori. He was unable to do anything while she was dying, including being able to show his daughter her mother one last time before she passed. He had questioned the trust he put into the physicians who recommended the therapy, as well as the team of physicians that treated her, and more than anything, he expected answers. The team of healthcare professionals involved were all troubled by Jolie's death, especially considering before starting the therapy, she was not in a life-threatening situation. One of the main doctors treating Jolie in the hospital, Dr. Kyle Hogarth, stated in an article in NBC News that they had all unfortunately been around it, but this one just seemed even sadder, because she didn't have a life-threatening illness to begin with. Other than being troubled by her death, they were also very confused. They did not know if the therapy is what caused Jolie's death or if it was something else, such as an interaction between the anti-arthritis drug she was taking prior to and the TGAA94 virus. As for the sponsor of the experiment, Targeted Genetics Corporation of Seattle, after learning of Jolie's death, they temporarily stopped this experiment and took time to check over all 125 patients that were about to take part in this gene therapy experiment in order to make sure that whatever happened to Jolie does not happen to anyone else.
In 1990, when gene therapy was performed for the first time on 2 patients suffering from adenosine deaminase deficiency, there was immediate excitement around the process as many hoped that it would one day be the answer to most, if not all, of our genetic conditions. However, most people failed to realize that that trial was performed only to test the safety of the procedure, not its efficacy, as the patients were still being administered with PEG-ADA, the standard drug for enzyme deficiency. A lot has changed since then. Gene therapy has been called the future of medicine, but with recent tragedies like the death of Jesse Gelsinger and in this case Jolie Moore, the validity and credibility of that statement is called into question, and for good reason. Jolie Moore was living a relatively normal life despite her condition before she decided to enroll in this clinical trial. Although the trial has been formally cleared of responsibility for her death, it does not mean that it had nothing to do with it. Correlation does not equal causation. Perhaps it was a blend of factors including the delivery of this viral vector that led to her passing. It would seem naive to completely dismiss the fact that the symptoms that eventually led to her death overtook her immediately after the delivery of the gene. Despite these tragedies, gene therapy remains in the spotlight as one of the most promising solutions to genetic conditions. But why? Why is it that a medical practice that has failed so many times, sometimes at the cost of a human life, remains a hopeful endeavor? Well, recently, researchers in Italy successfully regenerated the skin of a young boy suffering from a genetic condition called junctional epidermolysis bullosa by delivering functional copies of the mutated gene through viral vectors. It is because of promising results like this that gene therapy has withstood the test of time and will continue to do so in the foreseeable future. In fact, in late 2017, the FDA approved several gene therapies, including the one for rheumatoid arthritis. The Center of Human Drug Research, CHDR, is conducting the RA gene therapy trial, and results will be published by the end of this year. Now, it is very hard to imagine the pain of Jolie Moore's family and friends, but if there is a lesson to be learned from her story, it is that we must consider seriously the risks outlined in the consent form and make an informed decision before we participate in any trial.